Well, hey, everybody. The thing says we're live, and there's this red blinking light, so it must be true. My name's Jake Milstein. I'm the host of today's event, and I run marketing for CI. Today, we're here to talk about the 2020 Healthcare Data Breach Report, authored by Drex DeFord, who you see at the bottom of the screen, and Vivian Zhao, who you also see at the bottom of the screen. And I'll talk about everybody in a minute. As we wait for people to get in the room here, I just want to thank folks for joining us. CI, we're a cybersecurity company, but really we all got into this because we believe in saving lives. And one of the great things that we get to do along with our hospital and our other healthcare clients is to save lives. Some of the attacks that get stopped, some of the assessments that find vulnerabilities. We know very well that the work that you all do is with patients every day, and that that an attack can be very costly, and we're not just talking about money. So we want to thank you all for being here, and I just want to personally thank Drex and Vivian for authoring this very important report, because if we don't know what's happening and why it's happening, then we can't stop it. So the way this is going to work today is I'll intro everybody, and then Drex and Vivian are going to talk about the report. As we go, there's a chat on the right-hand side of your screen. Go ahead and type in questions. If you ask questions, we'll either answer them in the chat or I'll ask them to the group for you, and stay to the very end, because what we do at the very end of these is we have a survey. We want to know how we did. We want your opinions on these webinars and whether we should keep doing them and how we did. Also, at the end, if you take the survey, you can either get a gift card or donate to a food bank, which is awesome and especially needed in this day and age. So, and then Kevin put in the chat, greetings. All right, Vivian, next slide, please. So the presenters today, Drex DeFord, former CIO at, a whole bunch of places, Drex, but Seattle Children's and Scripps, and he's a report co-author along with Vivian, who's our healthcare program manager here at CI. Mike Hamilton is co-founder of CI, is former CISO of Seattle, and then Nathan Wright is the director of IT at United Derm Partners, and overall awesome guy. Nathan, especially, thank you for joining us. We can see that in the pandemic, you've put on a beard, which is good. All right. And with that, next slide, Vivian. I'm going to hand it over to Vivian and Drex. We're going to talk about the report. I'm going to put in the chat here the link to download the report. I think most people have, but if you haven't, I'm going to put the link in there. And Vivian and Drex, all yours.
Great. Thanks, everyone, for joining today. These are just some snapshots from the report, and Jake's putting the link to the report in the chat, where we analyze the data from the HHS breach portal and really dig into why we're seeing what we're seeing, which is an increase in breaches in the second half of 2020. A lot of good information in there and what you could do about it now. Just some brief background in terms of the data that we analyze. Data about breaches for covered entities is actually made public. You could access it online. There's a website for it for the HHS breach portal. Some people call it the Wall of Shame. Any covered entity where there has been a breach of 500 more individuals or patient records, they must report it to HHS, and then HHS puts that incident publicly available on this breach portal. It talks about the number of individuals affected, when the breach happened, the type of breach, the location of breach, and what type of public entity it is. So this includes everyone from health plans to hospitals, clinics, healthcare providers, business associates. In addition, they also call out whether or not the breach was linked to a business associate, so third parties. And definitely, if you have any questions, please put it in the chat. So we exported all this data and really crunched the numbers and looked at trends. This latest breach report that Jake put in the chat is actually our second report. Our first report came out last summer where we analyzed the first half of 2020. And we also look at trending data all the way back from 2018. And what we saw was, the number of breach reports, the number of hacking and IT incident type reports normally trend upwards. And it was unusual because the first half of 2020 is when it actually started dropping, and we were not expecting that drop. Our theory was that many covered entities, especially the healthcare, were distracted by COVID and either didn't get around to reporting the incident or maybe didn't realize that there has been an incident yet, not until potentially the second half of 2020. And we were expecting and predicting a surge in the number of breach incidents and the number of individuals or patient records impacted in the second half because we were not expecting the drop. The big question was, have organizations been breached and just don't know it yet?
Yeah, unfortunately, what we found out was that as we got into this, that may have very well turned out to be the case. We saw a lot of reports in the second half of the year that actually originated in the first half of the year. One of the ones that you probably have heard about is the Blackbaud breach. Blackbaud is a customer relation management system for healthcare organizations who have a fundraising capability, and they keep track of donors in there. They often will put other information about the donor in there, even if they have been a patient. And so as a result, when Blackbaud was breached, it breached the data of lots of different healthcare organizations. And so this was the first time that we had really seen this in a real big way, where a software as a service vendor had been breached, and then that had created this sort of cascade effect. Lots of healthcare organizations then had to in turn go to the HHS Wall of Shame and report that they had data breached through this business associate agreement. This was one of those situations where they think they were breached back in February. They didn't really understand what was happening until May, and then they didn't tell anybody until July. And that set off a whole series of events, including all of these reports and including a lot of lawsuits. And we can talk about that more later, but definitely this is the kind of thing that gets bound up in court, not only for the people who had data breached, but also for the healthcare organizations who had to report that they had data breached. We know at least one of those that has also been sued in this scenario. Next slide, please, Vivian. So, that's the problem with breaches, right? The other big one that you have heard about in the second half of the year is University of Vermont Medical, a breach that happened through a ransomware attack that University of Vermont Medical, a very large healthcare organization that runs an electronic health record that they actually share with many other organizations. Once they were breached and they lost their electronic health record, that meant that all of those other partners who use that electronic health record lost their electronic health record too. A massive clinical and financial impact. From a financial perspective, we see a lot of reports saying $1.5 million a day. I think that's conservative, and I think that's probably just limited to University of Vermont Medical. All those other partners also had financial impacts. And so again, a big cascading event resulted from this. But most important, maybe the most important thing to come with this breach, or any breach in healthcare, is actually the impact that happens to the patient. And as you can see up here in the upper left, a headline that says that, patients felt like they were left in the dark once this happened. Once the electronic health record went offline, we rely on it so heavily that I don't know when my next appointment is. The information that they had about me seems to be, missing. People try to reconstruct this in the meantime while the systems are brought back online. And in this particular case, it took several weeks for systems to come back online, and they're still figuring out how to bring some of their capabilities back online. Vivian.
Great. So I'm going to dive into some highlights from our latest breach report. Here you can see a little bit of graphs. I'm just going to quickly walk through this. First of all, when we look at the number of breach incidents reported in the first half of 2020, as we said before, it was unusually low. And just as we expected, there was a surge in the second half of 2020, 270 incidents from the first half, all the way up to 366 incidents in the second half, which is a decent jump. What's even scarier is the number of patient records or patient information being breached. The first half of 2020, 7.6 million, that's not a good number already.
Right.
If you look at the second half of 2020, that's nearly triple the number of records breached, over 21 million records.
So, hey, not to interrupt, but we're looking at 2020 here. When you look back at 2019, how since the beginning of 2020 was a depressed number for the reasons you talked about. What did 2019 look like?
Yeah, we actually looked at data all the way back to 2018, and then through 2019 all the way to 2020. What we're seeing is a continuous upward trend of the number of patient records impacted, and then just plainly the number of incidents happening. Of course, there's been a few outliers, extremely large breaches that could skew the data, but if you trend it, it's always been upward, and except for the first half of 2020, which was highly unusual.
Drex, what do you make of that? Why does it keep going up?
I mean, I think it's it's the result of the world that we live in. Everything's connected to everything else. We continue to try to work really hard to figure out how to connect more things to the network, more things to the electronic health record. We continue to roll out APIs, which may be another whole problem that we're ultimately going to have to deal with. We have interoperability issues, and we're trying really hard to figure out how to do better data exchange between systems. And all of this, if it's not done well, creates a great opportunity for cyber criminals to put their finger in that data flow and be able to get what they want to get out of it. And because we're so interconnected, breaching one organization certainly creates the opportunity to then leapfrog into other organizations. And so it's a challenging time that we live in. You add in IoT, you add in the sort of the big push now that you hear people talking about hospital at home, and how are you going to manage those devices on a network at home for a patient? It's complicated, and so there's a lot of challenging risks that go with healthcare today, and unfortunately, a lot of it reflects back on patients and families.
Makes sense. Thanks.
Great. And then looking specifically at hacking and IT incidents, which is what you read in the headlines every single day, it's still pretty bad. Let's put it that way. 97% of all hacking incidents, that's most of the incidents reported on the Wall of Shame. And again, it's only trending upwards. And one, actually, I would say the most shocking piece of data that we saw when we're doing our analysis for the latest breach report is business associates. So as we discussed before, every incident on the HHS breach portal, the Wall of Shame, it must disclose whether or not the incident was related to a business associate. In the second half of 2020, nearly 75% of all records breached were tied to business associates. And you can see that's a big jump from the first half of 2020. And in addition, we looked at the trend since 2018, and the number of incidents related to a business associate, it's a straight upward line. There's no outlier to even disturb it. It's just been a straight upward line. So Drex was talking about Blackbot. That's a perfect example of how, the organization itself, that hospital, that clinic, might be doing their best to protect their information, to train their end users. But if a third party that they're working with gets breached and you shared patient information, you're also breached, and you must also report to HHS.
And so, I want to get into business associates here. So, everybody's done, Drex, you talk about people putting up walls around their system, the castle walls. I mean, here's another way to get in. I don't think it's a surprise, but maybe a surprise at just how big this is.
I think that it's surprising at how big it is in the second half of the year. And there are, probably as the second half of the year continues to be reported out and investigated by HHS, and we get more details on the breaches in the second half of the year, I think we'll know a lot more and understand a lot more about actually what happened with who in the second half of 2020. But to have those reporting check the box that says a business associate was tied to this breach, just again kind of helps you understand that the old school way of doing cybersecurity, which was sort of building a wall and digging a moat around your castle and trying to protect yourself, just isn't the only way to do cybersecurity today. The new model really has to be, you have to have people watching every one of those entrances and exits, all those interconnections that you have to other castles in the kingdom, whether it's a drain pipe or it really doesn't matter. To carry the analogy probably too far, you need to have somebody watching every one of those entrances and exits, because that's certainly a way that the cyber criminals have figured out they can take advantage of invading the castle and getting their hands on the crown jewels. See, I definitely went too far.
Yeah, so you mean you need what is it, the rats of unusual size in your drain pipes?
ROUSs, yes.
ROUSs, yep. So Nathan, I'm gonna bring in Nathan here for a second. Nathan, you're the IT director of United Derm. You have dozens of clinics, you see this with business associates. First of all, does it surprise you? And second of all, what do you do about it?
Yeah, good questions, Jake. As far as surprising, as much as I hate to say it, the answer at this point really is no. And I think as I was listening to Drex there, the model has shifted, right? And I think especially so for sort of that small to medium sized business. And so what I mean by that is, if you were a large mature organization, a lot of you have your core competency, right? But then a lot of the other pieces you had in-house, right? So while you didn't have direct control of every little thing that was happening, you had a lot more. And I think the other piece is you could kind of control the speed at which things were changing, right? And so now it is, you still have, your core competency. So in our case, right, dermatology clinics and physician services around that, you still have your core competency, but so many things now are, a core competency of a business associate, right? Or a key partner. And so the challenge there is, how do you exercise, right, that amount of control and communication with them, but also manage the speed at which they're changing, right? And how those changes affect you as well. I was just thinking too, as we try to manage this risk for UDP and others as well, for a long time it's been sort of your asset management, right, as a key, right? Regardless of the moat around things, it's just know what you have and where it is. And as a third thing, what it's doing, right? But now it's become the vendor management, which has been a term forever, but in a very similar way, right? You have to know who you're connected with and how. And then at the end of that, there's this ... that says, and then know who they're connected with and how. And then know who they're connected with and how, right? And so, it's sort of, if you think about it like that, it sort of blows your mind. But I also don't think it's impossible necessarily. I mean, it took us a while, but we sort of figured that out from an asset management perspective too. So are we there? I think the data sitting in front of us would say that we're not. But I think we can get there. And I think really it has to do with, the vehicles and the legal pieces and how we connect with other organizations. But I mean, to be frank with you, a lot of this, and this is just sort of me too, comes down to the relationship. regardless of what kind of legal things you can put in place, and you need those, you also really need that, relationship with your partners to work as if you were one organization, even though, that's less and less the case.
Yeah, and Mike, Mike is both the founder of CI and the CISO. Mike, you were the CISO of Seattle. You're the CISO of this company. You deal with a lot of vendors. In healthcare, outside of healthcare, what do you do to make sure that vendors, in this case, business associates, are as secure as they can be?
Well, we run them through a filter, which I think everybody does. Our process is to, in order of preference, require a high trust certification, a SOC 2 report, some third party assessment against a standard that we recognize, or here's my awful questionnaire that you're going to take a week to fill out. And that, I will say it is adequate. On the front end, we got to get way better at this. The talk about when you sign a business associate agreement, you are forcing your business associate basically to be under the requirements of HIPAA, right? So like we as a business associate, we can be audited against HIPAA. And when we start looking to third, fourth, nth parties, frankly, I think this is creating yet another opportunity for yet another pitch to a venture capital company with a 3-slide PowerPoint deck about how you're going to fix all this and be able to manage everything all the way down this food chain. Ultimately, I think even our own methods here have to get better, because this technique of using a third party that is a service provider to the greatest number of actual victims possible is a target. Right. And it's not just Blackbot. It happened to Tyler Technologies, and they're their number one service provider for local government. We all know what happened to SolarWinds. Company in France, Centrion, also network management software, compromised exactly the same way SolarWinds was, with exactly the same effect. So this is not going to go away, and we need better methods for dealing with this. And that might, somebody on the call might smell startup right now.
Well, so Nathan and Drex, let's say the medical professionals in an organization are like, you know what, we really need this thing, this piece of software, this device, whatever, and it gets, they're really excited about it, they're ready to sign, it gets to you, and you're like, wow, like they won't provide a SOC 2, they've said no to the security questionnaire, or they've said yes and it's just really bad. What do you do? Nathan, start with you.
Yeah, Jake, I think, Mike, your sort of 3 or 4 point plan there about how you evaluate new partnerships is right on. But it's something, Jake, that your question brought up in my mind too, is, the pandemic sort of, it tested many things, but one of the things that it tested was, the scalability and the speed of the controls that you have in place, right? So like Mike said, okay, leadership wants this thing and they don't have a SOC 2 or a high trust certification or whatever. So now you're going to have to fill out this 20-page security questionnaire, except leadership's coming to you and says, I need this telemedicine thing like tomorrow. And that telemedicine thing, is getting, sign up for a demo on their website, right, at 100 companies a minute. So they don't care about your security questionnaire because they've got 500 other people that, are ready to sign today, no matter what. And so I think that was, again, sort of that perfect storm that results in the data that we're seeing here. But I would just say that as an IT leader in that space where the business is coming to me saying we need this tomorrow, I think it really is my responsibility, and probably others on this call, to have that conversation and say, here's the 2 options. Either we go through this process as quickly as we can, given all the other priorities that we have right now, to get to this level of risk, right? Or we don't, and we accept this level of risk. And I think as long as that, well, I would say as long as everybody agrees to that, then it's all good. Well, it's not if you end up on the wall of shame, right? But that's really the method that I've found, to follow in getting consensus around how much risk, are you willing to accept?
Yeah, and sending that up the food chain or up the governance chain to put somebody's fingerprints on that, so the appropriate sphincter tightening happens with the appropriate person that will then own the risk and understand what this exposure means. And
that's right.
That is the by the book way of doing it. You are spot on.
Yeah, I think the other thing I would say about this is we're making an assumption that an organization actually has a process where procurement is involved in a yes or no decision before something is bought or before a new service is added. And that isn't always the case in many organizations. They buy things and then they come to security and say, you need to figure out how to make this, compliant with our standards. So having a procurement process that actually reads in those procurements ahead of time, gives you a yes or no, tells you where the gaps and risks are, and then lets the business make a decision, a well-documented decision about accepting the risk is definitely the best way to go. Then you take, in Mike's point, you take those risks, you take those exceptions that you've made and maybe any compensating controls that you put in place, and that's the stuff that you brief the board on every quarter. Here's all the exceptions that we made. Hey, the pandemic came and, as Mike Tyson says, everybody's got a plan until you're punched in the face. But we got punched in the face and we did a whole bunch of stuff that we would have never done otherwise. And here it all is. We're going to have to go back and clean this up. And you guys need to keep on us until we get it cleaned up. Those are the kinds of pieces of activity that really have to happen that I think many healthcare organizations are struggling with. And that's why we saw what we saw in the first half of the year, continuing into the second half of the year, where everything was reported and everything looked really good in the first half of the year. It's not that it looked good. It's just, I think we made a lot of exceptions and now we're figuring out that we didn't go back and clean them up maybe.
I think, Drex, I'll just add one more thing to this. And one thing that sort of helped keep my sanity and that I've sort of learned in some cases the hard way is to remember is that, complexity is the enemy of security.
For sure.
And so trying to remember to keep it as simple as possible, throughout this and whatever partners you're evaluating, if they come to you and say, well, we got to hook this up over here and connect this over here. And then if it all works and you hold your nose just right, you can have a telemedicine call, right? And who knows where the data is stored or where it's going over the internet. So, and sometimes you're so overwhelmed, you're like, yes, we just need that. But if it's helped me to remember, hey, keep it as simple as possible, including how you structure your partnerships and your service providers.
I was surprised recently to find that somebody hadn't heard of the KISS principle. Just keep it simple, stupid. You have to pause before the last S. Drex and Vivian, I know you have a couple more slides here. Let's get through those, and then we're going to get back to this question of third parties and business associates. I think it may be the most important thing we tackled today.
Sure. A lot of Vivian, if you go to the next slide, a lot of the stuff that we just talked about are things that we talk about more extensively in the report. There's sections that cover all of these areas. Again, we sort of talked about contracts already, making sure security is a procurement priority. Telehealth, like Nathan said, there were coming out of the woodwork, there were new telehealth providers and new telehealth capabilities and lots of things that weren't normally considered to be telehealth that somehow quickly, instantly became telehealth providers. And so that requires special attention. And we sent all those people home during the pandemic, and a lot of them are still there. So protecting the work from home environment, 6 out of 10 people that are working, doing work at home are doing it on personal devices. That's a huge challenge and issue that we've got to work through. And the other things that we have here, including, Nathan's point about, keep it simple. make it simple, or Jake's KISS principle. Revisit the security basics. I mean, these are the things that, if you just have really good basic hygiene, you can avoid most of the problems and issues. Two-factor authentication, not allowing personal devices on the network, complex passwords, things like that. Slide, Vivian. So, I mean, the bottom line in all of this is that, especially if you're a small or mid-sized organization and you're struggling with all the things that are happening in the pandemic and all the other things that are going on, you're super stressed right now. And we totally get that. We work with small and mid-sized organizations all the time. And the bottom line here is that there's no magic pill to solve this problem, but ask for help. I mean, we're here to help. That's what we do. That's what the company was born doing. And the first conversation doesn't cost anything. Help us, call us and let us help you figure out what some of your approaches might be to some of the problems that you have. And next slide, Vivian.
See, it's the Q&A and discussion.
Ta-da.
This is what we've been doing.
Okay, now the gloves come off.
The gloves come off. I feel like after Wayne's comment, I should be making more Princess Bride references. So I'll try to think to go here. Nathan, I want to back up here for a second. So some of the history here is obviously Drex and Vivian wrote the report, and Nathan, the first time you've read it, were there surprises in there for you? What did it make you think?
Yeah, I think, a couple of things that you guys already addressed that came to my mind as I read that report was, sort of the prophecy that you gave with the prior report came true as far as, a reduction in the first half and an increase in the second half. But then I was curious, what is the overall trend doing? Which you guys addressed. It just continues to rise. And then the one other thing that sort of popped out to me in that report was talking about the work from home pieces. And so, when the pandemic started, not only with CI, but other, industry groups that were having these discussions, it was like IT leaders were saying, over my dead body, are you going to touch my company information with a personal device? You either don't work or you wait until Dell finally gets the backlog of millions of laptop orders, if you didn't already have them, to be able to do that. And so that was one thing as I read the report, it seems like, and it makes sense that companies are figuring out how to balance that risk, and to control access on personal devices. I still don't think it's widespread, but I think there were certainly situations that forced that hand. And if it wasn't done in a measured way, our organization's now going back, and pulling those back in or trading them out, et cetera. So have you guys seen, or come across clients or industry, associations that have been doing more of that? Or are you still seeing the, over my dead body situation?
I don't think I've seen much of a change.
Yeah, I think when this all started, there were a lot of healthcare organizations who, their starting position prior to the pandemic was, over my dead body, will you work from home? You have to come to the office. You have to come to the hospital. You have to come to the support center or whatever. That's where your work is done. And as a result, security was built, again, go back to the moat around the castle, version of this. But, they were able to protect the castle because everybody came to the castle to go to work. And then when they sent everybody home, they had this huge realization that, oh my gosh, the perimeter now is, we've kind of blown it. It's out there somewhere. And sometimes they're coming back to the castle to go out to the software as a service provider, but sometimes they're going directly to the software as a service provider using maybe a personal device. And so there's a lot of stress now, I think, around endpoint detection and response, and how are you going to manage that? How does that integrate into a central, security program? And then the other part of it is I definitely see health systems, back to your point, Nathan, about trying to figure out how to make it more simple, doing things like accelerating rollouts for virtual desktop and things like that, where essentially everything inside the data center inside the castle becomes kind of our own internal cloud, and people outside, even if they're using their own personal devices, connect to our cloud, have a virtual machine. That's where they're doing all of their work. So I see people trying to simplify it by doing work like that too.
Yeah.
Yeah, oh, go ahead, Mike.
Well, for everybody that got sent home to work, the ones that didn't go, with a organization issued device, I haven't seen a lot of change. Everybody who is working from a home computer is still working from a home computer, as far as I can tell. But I do want to talk and that does blow up the attack surface, to your point, right? But the other side of this is the threat. And for a number of reasons, one of which is clearly the increasing sophistication of the criminals, right? So as these guys evolve, there's now collections of actors that work on these campaigns, and each one does a little bit, right? One of them gains persistence, one of them is establish the beachhead, and all these people work together. One of them is the phishing messages, subsidiary or whatever it is. So there's that increasing sophistication, which makes it harder to rely on just the basics. Okay, so that's number one. The tools have become easier to use as well and more widely available to non-skilled actors. That's also true. Ransomware as a service is a thing. Buying a kit for, $35 to run your own, that is really a thing. So, the proliferation of tools, the dumbing down of the ability to use them also increases this threat population. And then there's one other factor too that I think deserves a little bit of discussion, and that's the fact that economic fallout drives people into crime. So here we have a real easy crime to do, and we have a real bad economic fallout. And I think the combination of those also is contributing to all of these upticks.
Well, so let's dive into that, because one of the things that happened last year, and I'm sure everybody remembers this, is all of a sudden there was this explosion in Ryuk ransomware attacks on hospitals. I believe there were 4 or 5 confirmed ones.
We caught one today, right?
We did. It turns out that at one of our clients,
at a hospital,
a contractor brought in a device of some sort, and it had malware on it that was trying to execute Ryuk ransomware. And our security operations center, one of our analysts, caught it and called, and they were able to keep it from spreading onto the network. But so Mike, when this explosion of Ryuk ransomware last year, why did that happen? Do we know who did it, and is it still going on?
Yeah, the gangs were kind of named, and it was this combination of TrickBot and this Ryuk, whatever, ransomware package. My original assessment was that there was yet another third-party service provider involved that was providing some kind of access into all of these hospitals, and that's why they were saying that this is an imminent threat. It turned out to die down pretty quickly, and it never blew up into what they thought was going to happen. I still think that there was some kind of third party involved in facilitating access to a number of hospitals, and one piece of evidence that supports that is, I believe it was New York State, and it was 3 hospitals in a single county went down with this ransomware. And that sounds like the kind of thing where a common service provider that serviced all of these hospitals might have been a part of that. I don't think it's ever been shown one way or the other, though. So I don't know where this landed.
I think the theory's good, though, right? And that could be
my theory. Is
common service provider.
Good.
Yes. But it could have been anyone from an infrastructure provider, one of the
ISP.
telcos or something like that, ISP. It could be all the way to if they're all using the same billing provider, so it could have been, a non-clinical providing system. It could have been a business system. It could have been a clinical system if they were all running off the same clinical EHR or some other transplant system or something like that. That totally makes sense. That's something we're going to see if we haven't seen it already.
Yeah.
I mean, so at the time, it felt like a big emergency. What was it, Mike? Was it the FBI? Was it somebody was sending
CISA,
out
FBI,
CISA was sending out
HHS.
alerts? HHS was sending out alerts.
Mm-hmm.
Everyone was very concerned. And probably continues to be, on when you're actually in an organization, did people actually make changes at that point? Nathan, do you know, did people make changes when that happened?
I'll speak for our organization. It's the strike while the iron is hot kind of situation as well. And I will say that we did actually pull everyone together as an opportunity to review our incident response plan, not only from a technical perspective, but with our operational leadership as well. And to be frank, as we went through that process and what would we do, in this Ryuk ransomware situation, we identified some weaknesses and made changes related to that. And so, people talk about have that tabletop exercise every year, right? And and even myself is like, I got to make up a scenario. Well, no, I mean, the scenario was made up for you, and it was real, and so took that opportunity to do that. But one thing that it made me realize, again, although this has kind of been, obvious for some time, is it's not just, lock up your computers where you can't use them anymore. It is that, but then it's also the second ransom, right? Which is, hey, we're going to release all these patient records, in a public forum, right? So it's reputational damage as well. And so that's one thing that came out of that scenario is, man, I feel like we're halfway decent at this, detection and response, and how do we deal with that? But then, what about this whole recovery piece, not just technically, and not just getting people back to a place where they can see patients and work, but what about that whole reputational, risk if they were to release those records as well? So, that was my experience at UDP, and some of the things that came out of that, and things that, forced us to make some changes in how we prepare.
Yeah, I mean, bad news there, and alert. Actually, you guys responded and are better off for it now. Drex, did you see that in other organizations as well?
Yeah, we definitely saw organizations do things like start to think very seriously about who really needs access to email.
Yeah.
And at least for a compressed period of time, may have actually turned email off for the entire organization or for a significant portion of the organization. So that was kind of an interesting first step. Good defense, but at the same time, if you disconnect all the computers and turn off all the power to all the computers, they're going to be super safe, but you're not going to be really productive. So they have to think through, where's the balance in all of that. I also think a lot of people did what Nathan did in the spirit of never waste a good crisis. They had the opportunity to sort of bring executives together, bring frontline staff together, and help them all understand, again, that they are frontline cyber warriors now. In this new model, the people who are registering patients and taking out the trash but still have email accounts, those people are just as important in playing defense against all the stuff that's coming at us as the people in the security department or the people in the IT department. And I know a lot of them took the opportunity to do tabletop exercises and answer questions that they hadn't really answered, like, who in here has the authority to tell the team to turn off internet access for the hospital or to shut down email for the entire hospital? Because everybody kind of looks around that room and thinks like, oh, well, that person probably does. You really need to have that laid out, and it needs to have some priority sequence. This is if we can't get that person, boom, within 2 minutes, we ask this person, and somebody in there can make a decision. And you know what the process is. If you don't have that, That's another, like I said, it's another thing that's a real problem. And I think several organizations sort of figured those things out because of the nature of the threat coming through email or anticipated through email.
Drex, you and I had a little sidebar conversation back then about, this process. And, you had mentioned down to if you have to shut down the network, what if all your printers are network printers?
Right.
What if you only have X amount of paper to go, to offline processes to print whatever forms out? It's those things that you don't think about until you run all the way, through the scenario, but are like real showstoppers.
Those are great reasons to do the exercises, right? I can tell you as a CIO, we used to do those downtime exercises, and we had plans that said, okay, well, the last 12 hours of medical record is dumped to a PC that's on the unit, and the unit then can just print that part of the medical record, and at least we have the last 12 hours of whatever happened to that patient on paper. And we did the exercise, and that's exactly what we figured out. Oh crap, all the printers are networked, and so we have the stuff on the computer, we can't get it to a printer. We don't have the cables, the printers aren't set up like that, and so we had to go in and read, do all that work to make it work. Then we had to go back regularly and make sure somebody hadn't undone that because they wanted to use that printer as a networked printer, right? And so you have people who are doing things to try to be productive, and it turns out they're sabotaging your incident response plan. So you have to go back and check or put big notes on, and then, help to make sure people read those notes.
And just a question from me, when you exercise this, and I know that, everybody's required to do their exercises, and all too often an exercise is like, well, we got a piece of malware, clean it up, and they limit it to that. But if you do, it doesn't even have to be a functional exercise. If you do a tabletop exercise and you really try to simulate this, isn't it super important your recovery point objective and your ability to restore, if that is indeed what you're going to do? Because if there's a gap between where you left off and where you pick up, and you lose everything in the middle there, how bad could that be? Just that loss of that interval, any records created in there.
You want to take this, Nathan, or you want me to take a shot at it?
Well, in a tabletop exercise, we could go for 3 or 4 days.
Sure. Right. In a functional exercise, if you really had to get that back, do you have to pick up where you left off and somehow figure that out?
Yeah.
That's what I would think.
In the real world, it's like, hey, okay, we have 6 hours worth of hard copy patient documentation. Like, who's going to enter all that back in? When this thing finally comes back.
Jake will make me do it.
Yeah, I'll make Mike do it.
And so, I don't have a real answer for your question, Mike, as far as coming out of this, system by system. Did we have, a recovery point objective? No, not really.
That kind of planning is a pretty tall order, but I just think that's an underappreciated exposure, I think.
Yeah, it is. And I think sort of bringing this back around to our business associates too, right? I mean, if they're the reason this thing goes down because some server they had, right, got ransomware, which customer gets to come up first? Is it like you? Is it, the 40 companies that are 3 times your size, 4 times your size first? And again, I don't have an agreement with a key partner, even ones that I have great relationships with, that says we will come up first before all of your other customers. But that's something to consider. If everybody is coming to them at once saying we need this back up,
right, how
do they handle that? Yeah. This whole drill around recovery point objective and recovery time objective is it is a science into itself, because what you really should do is go through every major system that you have and determine real RTO and RPO for those systems. And that in turn helps you understand how much more money we should be spending to make sure that we can drive down RPO or RTO for that organization, for that system, because we can't afford to lose that much data. And so it helps you prioritize your spending. It also helps you really understand which systems that you have are the most important systems. And sometimes there are things you don't think of, like interface engines or email may not, off the top of your head make the list, but they are critical business operation systems. And so you have to prioritize those when it comes to what systems are we going to bring up in what order, and try to recover. That ties, Nathan, to a bunch of your third party, partners and suppliers. And can they bring us up in that order? And that's why the exercises are valuable. There's so many things that you don't know and don't understand until you get into it. We talk about backups all the time. Backups are awesome. You should totally do backups and air gap them. But the most important part of backups is making sure they actually restore.
Yeah.
Tons of people do backups, but when the restoration time comes, they're like,
"Oh, that didn't work.
I don't know. Yeah, what happened here?"
That's not automated, and I have to think about it and do it and test it, and ain't nobody got time or resources for that. But you're exactly right as far as the key.
Yeah.
Yeah, I think that, by the way, Nathan, ain't nobody got time for that is one of the biggest problems here, right? Not everybody can have the resources of, Mayo Clinic or Stanford Hospital Center, right? Like, ain't nobody got time for that. So, ain't nobody got money for that either. So, when you, Mike, you talked about this on a different webinar. So everybody knows that they could get hit by ransomware. This is a known thing. Mm-hmm. Knowing that you're going to get hit, besides saying, okay, I'm going to have backups, what else do organizations need to do?
Well, I think we just talked a lot about it. You need to practice it. You need to figure out, how that's going to work out for you when you try to do that. And, does your restoration of your backup work? The other thing to do, remember, there's this big series of events that happens before somebody presses the trigger and everything's encrypted, or you get a denial of service attack, or whatever it is, they're going to extort you, right? So your opportunity to see what was going on all the way up there is all about your monitoring and your controls and, your responsiveness and your ability to put out a little fire before it gets big. But once that thing happens, you call your insurance company and they're in the driver's seat. So there's not a whole lot of planning you can do, for the real event. And the insurance company is going to adjudicate to a large extent. It's a business decision. They're going to adjudicate, do we rebuild from, all the backups and just try to get this thing? And that's going to take a certain amount of time. That's going to cost a certain amount of money. And we may have loss of life because of that. Or do we pay the ransom and get back on our feet as quickly as possible? That is a pure business decision. And I would say in the exercises, in your planning, in your practicing, that's got to be a topic, right? What are we going to do here? What's the insurance company going to tell us to do? And what's most important for, patient care? Because that's that's what runs the day. That's it, right?
Yeah, make sure you're including these people in your exercises. Include the FBI in your exercises. Include, local law enforcement, whoever
and they'll be happy to do it.
Yeah, they will. And then when something happens, this isn't a person who you've never heard of before that you don't know. You call Joe at XYZ Insurance, and they've heard of you before, and they know you take this seriously. So make sure they're a part of your team too. There's a lot of folks like that you need to rope in ahead of time. Build those relationships. And
there's a part going on in the chat where we're all people are laughing about, vendors that say they're security centric.
Looks good on a t-shirt.
Looks good as the guy who runs marketing. Maybe I'll just get everybody security centric t-shirts.
Yeah.
Smiley face beneath them. I do want to tell folks we're getting towards the end of the hour here. I'm going to put the survey in the chat here. Somebody wants the t-shirt. Who's that? Kevin wants the t-shirt. Kevin, I might have to get you that t-shirt.
I think it would be a smiley face, but like a winky guy. Security centric.
And seamlessly integrated.
Yeah.
These are all such good marketing phrases, Mike.
Right.
I appreciate it. Hey, so in the chat is the survey. Please take the survey. We want to know how we did. We're not done yet. I have a couple more questions for these folks, but I did want to get that link. And yes, I do realize there is deep irony in telling security-centric folks to click a link. And I also realize the irony in saying, trust me, but hey, that's what I got. So, I do want to talk about final thoughts here. As folks, digest this report and digest what we're talking about with business associates, essentially nobody's trustworthy. Everybody says they're security centric. The t-shirts are getting made right now. Vivian, you look at, you're the data person. You look at these numbers year to year to year, what do you think?
In the breach report, it's like what we announce is matching the headlines, but I think sort of back to the basics. I know previously we've said before the threat actors are getting better and better, but you still need to go back to the basics, where in the data we're seeing like email is one of the top 2 sources of breaches. And who is using email? All of the staff that's working from home, and especially during this pandemic. And Drex has definitely talked about this in other presentations before, is you may have rotating staff, you may have new staff, you may have just traveling staff.
Travelers, yeah.
Hospital. Do they even know your security policies? Have they even been trained before? And now they have their cell phone with the EMR and the scanning and the photos, and all the patient information is in their hands and in their emails. And we're seeing in the data, that's also where people are getting breached. So, sometimes back to the basic security awareness training is something you have to think of, other than all the other strategies that everyone here has discussed.
Nathan, final thoughts?
Nathan.
Yes, the M key. So final thoughts from me are, do your very best not to compromise your security principles as you go through this process. I know that's really easy for me to sit here and say. And I will say I am blessed with a leadership team that supports that. But if you can sort of build your decision making at twice the speed it normally is required, right? But that simplicity, and don't compromise those security principles, I think you'll avoid, a lot of these issues.
Okay, looks like we lost.
Ooh, there was a lightning.
Oh,
clap.
You're back.
There was a lightning clap, and
I was about to take over for you.
Yeah, well, you're good job with that. All right, Drex, final thoughts.
I go back to something Nathan said earlier that I think is just, amazingly insightful and simple. And that is a simple infrastructure, a simple set of agreements, a simple set of vendors is the easiest thing in the world to manage, or it's easier than a super complicated environment that most of us have built over time. So do all of the stuff that you should do, like upgrade infrastructure. And in the process of doing that, simplify the way that you have it laid out and the way you have the stuff deployed and broken up. Look at places where you have duplicate vendors with duplicate products, and keep one and kill off the other 4, right? The more simple that you can make it, the easier it is to secure. And that's a really good place to start. And it's a great way to use security as a way to drive dollar savings in many organizations.
Yeah, and Mike, as you do final thoughts, I'm going to put up folks' email addresses here. So if anyone wants to contact the folks who've been in this, you can. My email address I put in there earlier. It's just jake@ci.security because I'm the vain one. So I have the vanity email address. Mike, final thoughts.
Final thought number 1 is to prevent this from happening. Yes, train your users. Yes, do all this stuff. It's more important to make it impossible for it to happen rather than expect a bunch of people are going to always do the right thing. So multi-factor authentication everywhere, because credentials are usually what they do. That email is trying to get somebody to give up a password. They're going to phish a password and they're going to walk into a network. So number one, multi-factor authentication everywhere is your friend. Number two, do what the country of Singapore did and just cut off internet access for anybody that doesn't need it. 40% of this problem goes immediately off a cliff, and I can prove it. It's been it's measurements we took at the city of Seattle, and it's been reiterated in other articles. Finally, pursuant to the chat we were having before all this started, I really believe that insurance companies are someday going to be writing those business associate agreements and setting those requirements, because they're the ones that have the dog in the fight. And you know, it's been suggested by someone else that ultimately they're going to be the ones to set the regulatory requirements. And I think this is probably going to show up in the health sector first.
Well, thank you, everybody. Thanks for joining. Reminder, the survey's in the chat there. I want to make extra special thanks to Nathan. Nathan, thank you so much for joining us and giving us the perspective of somebody who's in the hot seat as the IT director right now.
Yeah, and the acoustics in your space are really good, I got to say.
And as Bruce says, have fun storming the castle. Exactly. And Drex and Vivian, thank you so much for putting the report together again. You two do a great job. So thank you for putting it together. You know, really, we're all in this together, trying to do a service for the community. We want to save lives. We know the people who attend these are, you know, that's what you do every day. You know, whether you think about it or not, you save lives by stopping the criminals from getting into your systems. And thank you to Mike Hamilton, as always, for joining these. Again, the survey's in the chat. Thanks, everybody. And we'll see you at our next event if you want to come. Bye.